I'm an ear, nose, and throat doctor, originally from Pittsburgh, Pennsylvania. ENT doctors are doctors that were trained in both medical and surgical treatments. So we do a lot of training in our residency in the operating room, but then we do probably an equal amount of training in our residency in the office, treating general medical problems that happen anywhere really from about the eyes down to the root of the neck. Ear, nose, and throat, surgery-wise, we cover a really huge variety. So we do surgery on young children, which would mostly include ear tubes for recurrent ear infections, tonsil and adenoid surgery. We also do some congenital neck masses and surgery where we're removing lymph nodes in kids. And then in the adult population, we do everything from surgery on the vocal cords, sinus surgery, skin cancer removal, sometimes even in the office, ear tubes and tonsils on adults, and really anything else that you could come up with in the head and neck region is something that we take care of. Oftentimes we even will help the plastic surgeons and do the excisions of cancers and then have them coordinate with us to do the reconstructions. At WCA ENT, we cover a wide range of the normal ear, nose, and throat problems that you would encounter, which is a great bonus for people in the WCA area to be able to have surgery locally, also be able to be seen here, have their post-op care here, as well as a full range of audiologic services. And we also coordinate in the balance and vestibular testing for dizzy patients. And then we also do simple in-office procedures here as well, and sometimes office procedures that we're not even expecting, like a last-minute nosebleed or an abscess that presents to the ER. They'll be able to call us and sometimes get the patient in right away. I think probably the biggest thing that I usually try to get across to people about ear, nose, and throat is, there's a lot of ear, nose, and throat emergencies that are very obvious. People who are bleeding, people that aren't breathing well. But the one that often is missed, and sometimes missed in small communities, is people that have sudden hearing loss. And so for those patients, I just encourage them, if they have any change in their hearing, try to get into us as soon as possible. It's a time-sensitive issue. Sometimes we can save hearing by seeing people quickly and starting medications. And sometimes it just feels like your ear is plugged, or it just feels like you have wax. At the very least, I encourage people to just ask their family doctor to get a good hearing test, and that can tell them whether it's a true medical emergency.